threat of the coronavirus or COVID-19 spreading is a compelling reason as to why the public needs to apply precautionary measures with regards to health and hygiene. Information will help reduce the risk of infection, thereby reducing the risk of transmission to others should one be infected. But with many in South Africa still using unacceptable toilets and with clean water still a struggle for part of the population, basic protection measures such as constant washing of hands may prove a challenge. Now, the University of KwaZulu-Natal is hard at work creating an on-campus health war room to contribute to international efforts of fighting the deadly coronavirus outbreak. Professor Mosa Moshabela, the Dean and Head of School for Nursing and Public Health at UKZN, joins us from our SABC studios in Durban. Great to have you, Prof. Thanks very much for joining us.
Thank you.
Here with us in Johannesburg, we are joined by Professor Lucille Blumberg from the Institute, the National Institute of Communicable Diseases. Professor Blumberg, welcome and thanks so much for being with us as well.
Thank you very much.
So we need to talk about basic hygiene, things that we can do as South Africans to try and help the situation. I'm going to start in our Durban studios because we've been hearing some great things coming out of UKZN. One of them is stopping the use of biometrics for some of the students. Let's talk to that, Professor. What kind of things have you implemented at the university?
So the stopping of the biometrics is actually something that came out of University of Pretoria. Fortunately for us at UKZN, we hadn't started installing the biometrics. But the most important thing that we've been trying to do is to make sure that there is information. The primary concern that we have now, it's basically all the students that are placed in different hospitals where they might come in contact with patients, as well as the staff that are affiliated with the university who are also working in the front line. But beyond that, we are also concerned about the general community in the university, all the students and the staff. We've got about 50,000 students. We need to make sure that there are measures to protect them. Many of them are concentrated in university residences. Many of them will come to lectures and so forth. And many of them come from homes whereby if they were to actually go home, they might be able to kind of come into contact with coronavirus. Our approach basically is to think about different levels of response. Initially when we started with the war room, we thought that we would be able to achieve many of the health education and awareness aspects before we start having a case in KZN. Yeah. But 3 days after we basically decided to go ahead with it, we started having a case. And it's been 6 days now since the first case. And already we've tried to pick up all the trainings. We've been training different groups of students, training different groups of staff, especially the campus health services. We're trying to strengthen the service for that. We're trying to put in place a clinical response protocol. We try to put in place surveillance measures. We're also trying to put in place the health promotion measures that need to be put in place. A lot of the different schools and colleges in the university are asking questions to say, what is it that we are doing to protect students, to protect cleaners, to protect academic staff?
Yeah, and I think these are common questions that not only your university is asking, everybody in the country is asking this, if not in the world, how different institutions are putting in mechanisms to protect the interests of those that use these facilities. Yes. I mean, let's Professor, I'm going to bring you in, Professor Blumberg here, and it's so nice to be joined by so many professors, but let me talk to you now in terms of, I started off with talking biometrics. It seems that this is a big talking point because we use biometrics here at the SABC and a lot of other companies do as well. And this is a surefire way of spreading diseases. What do you think of this?
Well, I think, first of all, to applaud what the university is doing and the colleges are doing. And certainly it's about sharing correct information and what people can do to protect themselves. So the coronavirus is spread when people who are infected and are symptomatic sneeze or cough, and it's spread through droplets, and somebody very close to them may inhale. So it's really about teaching people, that's the first thing, to cough, to sneeze into something like a tissue and to throw it away. If they don't have, to do it into their sleeves, not out into the air. Yeah. The second is The virus may come onto a surface. It may last several hours. If
When
somebody,
you say, I'm going to interrupt you, several hours, are we talking, I mean, I've heard up to 48 hours.
you know, it depends on the type of material. It depends on the temperature. You know, probably in the range of 7 to 9 hours is quoted. I think there's a few hours here and there. But it really depends on the surface, the temperature, and it can survive there for some time. If you touch that surface, put your hands on, and I'm not going to do it, on your nose or your mouth, you may contract the virus if it's there in that way.
Yeah.
So it's really about cleaning surfaces and about ensuring hand hygiene.
Hand sanitizers.
Yes.
A lot has been spoken about the difference between actually cleaning your hands and using hand sanitizers. Which works better?
I think they're both important. I think not everybody has access to hand sanitizer. I think soap and water and washing for at least 40, 50 seconds and washing properly, I think is very effective. I'm not sure we all apply those simple rules.
No, we don't.
Yeah.
I mean, this is one thing that's become
Yes.
blatantly clear through all of this, is that through all these education drives,
Yes.
people have really sort of taken it a lot more seriously in terms of keeping hands clean and the
Yes.
basic hygiene that we
Basic
should have always
hygiene.
been doing.
Absolutely.
And these are the only mechanisms that we have available to protect ourselves. I mean, from what I'm understanding.
Simple things. It's a virus that's not so easily transmissible, but it's relatively easy to prevent transmission and prevent acquiring it. Cleaning a surface with household bleach is highly effective. It's a virus that will respond to that.
Yeah.
Yeah. So these are not, you know, very intensive measures.
One thing that
Yeah.
sort of I'm also interested in is
Yes.
people talk about washing your hands, making sure you do it properly, all of that. We don't emphasize drying your hands. Now, I've heard, please correct me if I'm
Yes.
wrong, drying your hands is as important as washing them. Because if you just wash them and leave them wet,
Yes.
you may be undoing everything that you've done in terms of washing.
I think drying is important. We must remember that many towels are shared, and that's not always a good thing. But yes, drying is important in doing it properly.
Okay, all right.
Yeah.
Professor, I want to come back to you there. One thing that Professor Blumberg did say here is that this virus is not that, what were you saying? People don't
Not so easy to transmit.
Is it? Do you agree? I need to ask you this. Do you think the same way? Because I'm questioning it. I mean, if you see a group of 10 people traveling to Italy together, and so far 7 out of the 10 have got coronavirus, that has alarm bells ringing in my head. But I am no prof, so I'm going to ask you that question. Do you also think it's not as easily contagious?
Leanne, that's a difficult question, but I think that from the position that we have taken is that there are two things that we are worried about this particular virus. Is that it is relatively speaking infectious and relatively speaking causing more severe disease. Those two things are concerning for us. It is also concerning the fact that it seems to cause more severe disease amongst people with comorbidity, people who are in later life, people who already have certain sort of predisposed to certain lung infections in some way, including smokers. So we're concerned about the risks that are there. But those two things, basically about the fact that it seems to be infectious and it seems to cause severe disease, are the things that we are basically looking at to think about what is it that we can do to limit the burden of disease. In itself, the problem is that if it's going to affect a lot of people, then the large numbers of patients who are going to need sort of more intensive support in terms of care are going to overwhelm our health system, which is also why for us it will be best to use a stronger public health approach that limits the transmission of disease so that we don't overwhelm our health system. It is likely that we may not be able to cope with that burden. My view is that because it is droplet spread, it's not as infectious as something that is airborne, and I think we need to be clear about that. But among some of the conditions that are more droplet spread, it seems to be transmitting a little bit more efficiently than other viruses.
Yeah.
And so, to me, you know, arguing or debating about, you know, whether it's 2.2 or 1.6, it doesn't matter so much. I think right now, we do kind of want to emphasize the fact that it is droplet spread. The more people understand how it's spread, the more equipped they will be in preventing its spread. And we know that we don't necessarily want to have a huge caseload, because if we do have a huge caseload, we are going to end up with a lot of severe cases that we may not be able to cope with.
And this is the reality, is it's a great worry, particularly in a country, and I keep saying this, is that, you know, there are some people that are fit enough to handle and have an immune system that can fight this virus, but we have a very compromised nation when we talk to the high prevalence of HIV, of AIDS, of TB, a lot of elderly people, and these are the high risk categories, and we're right up there, unfortunately, with a lot of these cases. This is where I imagine your concern comes in.
Yeah, just to clarify, I agree with absolutely everything that is said. You cannot get it by just casual contact, just walking past somebody. You really need to be spending a little time with somebody who's infected. You need to be in close contact, less than 2 meters. They need to cough and sneeze over you. You need to spend, 10 or 15 minutes with them. It's not just by being in the street and passing somebody with coronavirus. I think that's what we mean by not so easily transmissible. But absolutely, I agree with everything. And I think we are concerned about our vulnerable population. We don't know everything about the conditions that predispose to more severe illness, and certainly HIV is a concern.
Yeah, a big concern, because I know that we were looking at some of the autopsy results, and I'm not sure if you've had a look at those. You know, in China, there was a lot of red tape around it, but I know that the autopsy results were released. And the one thing that they were showing is how it really does hit the lungs. This is the one kind of virus that is very, very detrimental on the lungs and very difficult. What do we know from these autopsies? What have we learned?
So it causes what we call a acute respiratory distress syndrome. It's extensive, and it's more multi-system than just the lungs in these patients who contract severe disease. But I think we need to recognize that overwhelmingly, particularly in young, healthy people, it is a mild illness, and it's a self-limiting illness, and the majority of people do recover. We need to focus on preventing, reducing the risks in our vulnerable population. We need to remember that we have the flu season coming up, and that's a kind of confounder, and we need to vaccinate those who are at risk, and we need to apply these measures, and it's about sharing public information.
Yeah, and in all areas, whether it be universities, whether it be schools, in workplaces, and exactly what we're doing right now is sharing that information. Professor, we talk to areas in South Africa that don't even have access to water, clean running water. People that, we emphasizing wash your hands, use your sanitizers, make sure that you dry with a clean towel. I mean, these are things that we're talking to a very small population, because a lot of South Africans don't have those luxuries. What happens in a case like that, Professor? How do we stop the spread if we don't even have those basic things to keep our hygienes at those levels?
Leanne, I think that this is a really important question. One of the things that we have been learning through this process is that all along we've been having problems that we have not been dealing with, that have been predisposing people to disease anyway. But this is really exposing those weaknesses. And that exposure of the weaknesses, even on our campus, we are realizing that actually we've had problems with our campus health services and so forth, but we had not previously responded in the way that we are positioning ourselves to respond. And I really believe that we must not miss the opportunity now to realize that COVID-19 may come and may go, but this problem of risk of infections is not just going to come and go. And it's not something that is new. It's been there. There's been a lot of people already in South Africa who are exposed to disease and infections that should be prevented. And we've talked a lot about the fact that our health system in South Africa it is much more focused on curative services. It's not really strongly focused on upstream, what we call upstream factors, or the prevention and so forth, and health promotion. The whole idea of the health reform in the country needs to emphasize a lot more the issue of health promotion. And if we do that, we will position ourselves to make sure that even in local communities where there are meager amenities, people can figure out how to work with the things that we have. And as health workers, generally, we are not necessarily trained or equipped to be able to respond well when resources are limited, when equipments are not available. We need our gadgets. But there are other people who are trained to do that. There's a whole group of health promoters and environmental health workers that we have not really been adequately paying attention to in the way that we respond to disease and these kind of problems of transmission of disease and infections.
Yeah.
But the clinical virologists that we work with, strongly feel that right now we are overemphasizing the issue of sanitizers. We should be overemphasizing more just using soap and water, simple soap, and that will deactivate the virus.
Yeah.
And my guess is that if you look at the literature around sanitation, we've seen all over the world, even in very poor countries, people coming with very creative ways of hand washing in order to prevent disease. We can learn a lot from those lessons.
Yeah.
They just use like water bottles that they tip over, and they're using soap. Right now I feel like it's time for us to go back to look at what people have done in different contexts, in different situations, and put those measures in place. I'm afraid that we are responding a little bit late, and we're not aggressive enough in terms of health promotion and public health and population health. We're still so overcome by the fact that we've got 7 cases and we are wondering whether we've been in contact or not. But really, to break transmission and limit the caseload in this country, we need to make sure that everyone is involved in those sanitation practices.
Indeed.
And we can learn from previous examples of hand sanitation literature.
It is so important, and I think that particularly something like the Department of Education needs to prioritize that. We had the minister here, and it was a little bit of a worry that schools had not already had a guideline put in place that this is what you do, hand sanitizing, washing, if there is a case, this is what you need to do, and then we start seeing panic happening. I just want to ask you, Professor, here, we're running into almost news time, but in terms of having lockdowns. Now we're seeing something like Italy. We saw it happening in China. Now Italy, the entire country, 60 million people are on lockdown. Yesterday during the press briefing, we heard our health minister saying that's not something that we would institute. We don't need to as yet. But what is your view on lockdown and self-isolation?
So I think the focus now is...
I'll begin in the Johannesburg studio, and then Professor, I'll go to you in Durban.
I think the message now is identify cases and isolate them, reduce the spread. We don't have community transmission. People are looking at China. It was a huge intervention. The cases are going down there. Is it because there was a lot of immunity from high transmission in the community? Is it the lockdown? Not quite sure how effective it will be in Italy. I think we're still learning. But it's a huge commitment to do this. Huge impact on economies and people's lives.
A very big one.
It needs to be thought about very carefully.
Some questions that we're asking, and I'm coming back to Durban. I just need to finish off here. Why Italy? What has there been reason as to, I suppose, why China? I mean, that's another question. Why did it start there? We don't know. But a lot of people asking, Italy?
Don't know.
No idea. Yeah, it'll be interesting to see what it is and why, particularly that being the biggest out of China. And then finally, Professor Moshabela, you wanted to say something as well about isolation. Does this work, do you think?
Yeah, so we have taken lessons from Singapore, who have done a really amazing job in their response. And basically, we have adopted their model of the robot system, where they divide up they kind of position their response in 4 levels of response. Level 1 is when they don't have a case and it's green. Level 2 is when they've got isolated cases like we do now. And level 3 is when they start to have community transmission. And at community transmission, they start to have partial closure or partial lockdown. At level 4, where they've got widespread transmission, they basically insist that everybody works from home. They've got more widespread lockdown. And so we need to actually have a strategy on the levels of response depending on the burden of transmission in society. If we can say that, okay, we now have community transmission, this is how lockdown is going to work, we've got widespread, this is the burden that we're looking at, this is the extent of lockdown. We need to have that strategy beforehand, before we get there, rather than later on respond with panic.
Yeah. Right, really good advice, and maybe it's something we certainly can pick up on to look and see how other countries are handling this. Prof, thank you. Thanks so much, Professor Mosa Moshabela, who is the Dean and Head of School for Nursing and Public Health, on precautionary measures, talking to us about what can be used in terms of the means of reducing the risk of COVID-19. And here in our Johannesburg studio, talking to Professor Lucille Blumberg from the National Institute of Communicable Diseases. Thanks very much for the update. The time now is 8